You obviously gave birth before, right? You know how to squat. So we said it. Okay. Hello, mummies and daddies. Sorry, I'm not sure if you heard whatever we were saying just before this. So sorry about the interruption, but we are back. And once again, thank you, Dr. Wong, for being back with us. I'm here with none other than Singapore's favourite baby whisperer and senior lactation consultant, Dr. Wong Boh Boi. Hello.
Hello.
Dr. Wong.
Yeah.
Yes, and once again, thank you, mummies and daddies, for joining us at our Mummies Market live session, where today we are going to be going through breastfeeding tips, some common issues that mums have faced and how to deal with them, and of course, first and foremost, breastfeeding with confidence, which I think is the key note that we want you mummies and daddies to take away. I think daddies as well who are watching.
Yeah.
Right?
Yeah. Welcome to these sessions. It's a very open session, and please throw in your questions if you have any questions. I think our whole family should sit in, and then it's a family event, so we welcome all of you. Even babies, if it's not asleep, can join in as well.
Thank you. So yes, and once again, this session is proudly brought to you by Brand's Essence of Chicken, which is our sponsor today. Thank you so much. And later on, we will actually share some key benefits as well, and how Chicken Essence can actually help you in your breastfeeding and in your parenting journey as a whole as well. And also for you lucky viewers out there, we have 5 lucky winners who are going to walk away today with 12 bottles of the Brand's Essence of Chicken. We will be choosing our winners from those who have actually sent in their questions. We have actually a lot of questions. Thank you, mummies and daddies, who have sent in before. Yes, we actually have one question from Daddy, I think. Yeah. And also we will be choosing from these for these 5 winners. We'll actually be choosing for those who actually like and share the video, as well as comment, one key benefit of Brand's Essence of Chicken, right? So we'll be choosing our winners from this pool of people. So make sure to like and share the video, leave us a comment, and for those of you who have already sent in questions, thank you so much. We will be choosing winners from this pool as well. Alright, so Dr. Wong, can you share with us, because I think you are always telling us, it's all about the techniques and mastering the basics for breastfeeding, which is the most important.
Yes.
It's always starting off right. So can you share with us what are some of the key tips that new mothers, or mothers who are planning to breastfeed in the future, what kind of techniques and tips they should pick up from the start?
Okay, I think a lot of mothers are actually, of course, all moms wish to breastfeed. Most important that you have to always remember there are 5 key points. Number 1 is start early. That means we call it in the hospital itself, skin to skin after deliveries. That enhance your bonding, and also increase is based on evidence based that actually help you to establish lactation. Very important too is when you actually techniques. You must have the skill, and beside the skill, you must also have knowledge. If you don't have the knowledge and how milk is produced, you'll be very, very worried. Why no milk? Why no milk? So must have the knowledge. At the same time, very important, is ensure that technically you got a very skillful in the technique. So the deep latch, the baby effectiveness of emptying the breast, which are very critical, and also the positioning. So later on, I've emphasized a lot on proximity and stability. Stability means the baby must be stable, all right, on your breast. You can support with a pillow. Then proximity, that means always remember, baby is in line. Tuck the baby bum in, then support the neck, and then the baby actually support your breast, and that is called, what we call proximity. Baby chest to your chest, tummy to your chest. So there are a lot more technique beside the top itself. Like we always say, your flange up lips, lower lips, and then chin touch the breast, baby in line. All this you must learn. It's actually important.
And that's why you've actually dedicated so much of your life to actually teach mothers. I think many of your students might be tuning in today. If you're a student of Dr. Wong's, please say hi in the comments to her. And because Dr. Wong also has run many classes and seminars that teaches moms how to, in great detail and hands-on practice, as to how to establish that that good latch, how to carry the baby, and some of the other tips that you also share for overall antenatal and pre and postnatal for during your classes as well, right?
That's right.
Yeah.
Very important. All I'm going to share with you is evidence-based. We're talking about big population, not one person. All right, it's idea. Okay.
Yeah, and I think it's important to note also that like you have always mentioned, sometimes parents or a family or friends are always offering mummies tips and advice about breastfeeding, and they mean well, but it's important to not also get distracted by them, and they want to offer their advice, but it's always best to learn from a proper internationally certified lactation consultant on like Dr. Wong, for example, on your breastfeeding journey and how to establish tips. Am I right?
Yep. Because a lot of people, based on own ideas, are out there and they want to share with you. Actually, can be just conflicting advice. Then you can be very confused because there's no evidence base. So today we try to iron all this out based on this evidence.
So can you share with us, Dr. Wong, when the baby is freshly delivered, out of the mom after 9 months, they have some natural reflexes as to want to start to breastfeed as soon as they come out into the world, right?
Yes, of course. Newborn baby actually followed by the scent or smell. That's why we do skin to skin. When baby is born, I always like to say, baby like lost in the South China Sea. Then you expose the breast, the darker areola, which is a nature's way, make it very dark. The brighter, the bigger areola, the darker it is called the lighthouse. So when we pop baby to your breast, the baby able to search for it, and that is a nature's way. Baby born, just go and do that. So it's important let nature take its time. So that's why skin to skin is about an hour. That's the BFHI recommendation and the WHO.
Right. Okay, then this is something very new to mothers because from a young lady getting married and then becoming a mother, I think especially for our expecting mothers who are watching, they might not necessarily know how milk is produced in the breast and how everything is a signal being sent to each other. Can you elaborate more on that?
The breast actually is endocrine organs, so it's glands. So it's very important. Inside there you can see there is all glands.
Oh, wow.
Okay.
It's like
Alright,
grapevine.
correct. So usually the nipple is protruding at the top. So it's they like grapes, the branches of grapes, and the milk is produced by the alveoli cells. Then go through the little duct, then go through the major duct, then it go through the nipple hole. So when the baby latch, this milk will go through here, and then the baby able to empty them. So they go through basically these nipple holes.
Can you share with us about the let down reflex? What is
Let
that?
down actually is like a reward when actually mother after 10 days when the breast milk is fully established and the mature milk starts coming kick in, then 1 or 2 minutes when mother actually either through tactile or audio or visual, there is a form of reflex and trigger off so the oxytocin contract the alveoli cells and release the milk and a great amount, so the mother had got let down. It's well known that sometimes documentation had indicate but let down almost 43 ml of milk. So you have to let down, but sitting is super. So let down is relaxed. Let the endocrine hormones actually work on it.
Right. And so the breast can actually detect that a crying, like every time the baby is crying, and then we always hear mothers that even they know it's not their child crying,
they got let down.
Yeah, so
because it's a hormonal response, emotional as well, and it's good. Yeah, we know. Then rather than those mother who never have let down because you're very tense. Right. So try to relax. You're right, Jen. So try to relax, and then let nature take its own place. And just enjoy that baby.
Okay. Can you also share with our mummies and daddies who are watching today, how do you know when your baby is ready to feed?
Well, there are many signs that in the daytime it's good to watch for early cues. Right? Hunger cues, baby can be mouthing, a bit of movement, and let me and then maybe sucking the cloth, their hands or whatever they can reach for, and then they will cry after that. And then there is a middle cue, they get a bit angry, a bit desperate, they may scream. And then last cue is a late cue. They can be so angry and so frustrated, screaming non-stop. I found that when I put the baby to the breast, is my own survey, they usually cannot latch on immediately because they're so overwhelmed by it. So they cry and they struggle on the nipple for at least 1 minute. After that, when they start suckling and the vacuum is always broken, it's not effective because by the snuffle, like baby, when
From
you
the
cry.
crying,
Yeah,
is it?
correct. And then after that, also very sad that they get tired very quickly. So it's not effective emptying of the breast. So maybe I have done my own survey. After 5-8 minutes, baby gone to sleep. And maybe never actually empty the breast properly. So it's not quite full, but because of tiredness, actually he falls asleep.
So that's again one of the basic things that Dr. Wong has mentioned earlier is you need to effectively clear your breast several times, because you mentioned that also it's like a bit like a warehouse, right?
Yeah. Correct. Jen, your breast, the first 3 months is based on hormonal response, your production, hormonal. So that's why we even take certain things to enhance the hormones to release prolactin. And about 3 months later, like a warehouse, your emptying of the breast is like a warehouse. The more empty it is, the more goods will go in. So the response to the baby cue is very vital. So the mother must always try to learn daytime to observe the baby for cues. Nighttime are likely to do demand. Let the baby numb for it. So daytime you do a lot of interaction. You're telling the baby, girl, boy, daytime you play, you feed, and you interact with mommy and family. Nighttime, no play, just eat, minimal interaction, and settle to sleep. When it's darker and quieter. So very quickly, baby adjusted to this, the routine, and it's much easier to handle.
Right.
So we do wake the baby, non-demanding baby up. That's why, academic or pediatric recommend we wake baby up. Don't let them sleep more than 4 hours in the day since the last
daytime.
Yep.
Okay, right. So in the day, keep the day environment like the day. So wake up for feeding.
Just naps.
Yeah, just naps. And then in the night is when you don't disturb baby. And I think that's one of the questions that one mummy has written in. Later we can go through it. But the mum asked, should I wake the baby up for night feeding? Which later we will go through the questions.
Yeah.
Okay. So, it sounds like a whole day affair, 24 hours.
Correct.
Right? We also need to make sure that, of course, firstly, the baby is well fed. But how about the mother? Right? What are some of the tips that you have for mums? Because you're basically feeding takes about 15, 20 minutes, and you are doing it several times a day. So how do you advise mums to position themselves such that they don't suffer from backache or
very important when you're breastfeeding, always have a good armchair or a good support with pillows at the back, and always also don't hunch. Don't ever hunch like that. When you hunch like that, your shoulder is frozen, or you do like that, it's very silly. The milk flow is coming down this way. When you're like this, halfway, your neck become frozen, your shoulders become frozen. Then 1 week later, you have aches and pain, and then no way can breastfeed. If the mother is not well, no way she can breastfeed comfortably. So sometimes, per sitting can be 15 minutes, can be half an hour. Alright, so it's very important. You got to be comfortable, and then you got to hold the baby correctly, got good support, and then you're able to do the things. And also, breastfeeding mother can be very tired. As you said, they're extremely tired. Right, and also, when you're breastfeeding, you need extra 500 calories. You know that, girl. You burn about 500 calories. That's why in the class I always say to you, you lose weight very fast. The basic metabolism rate is never increased, but you need the extra 500 calories. So, you can be tired. So you got to learn to, adjust yourself, routine, how to feed, and how to correct yourself. So diet is very important. Breastfeeding is very thirsty, you know that.
Yes.
Very thirsty and very hungry.
You want to drink a lot of water, you want to drink a lot of soups, You also will feel like drinking a lot of chicken essence because it's also good for you. Like Dr. Wong mentioned earlier, you know, moms, a lot of time moms are very tired.
Yep.
Physically and mentally, because breastfeeding is also a very much a mental activity, right?
Yeah.
Right? So
very good. I think you need the basic nutrients. Just a sidetrack a bit. When I walk into the postnatal floor, when I walk in, breakfast there, mother breastfeeding. Lunchtime I went back, breakfast still there, never touched, and lunch been served. So mom, be aware, you've got to take something, you know, to replenish yourself, your energy. Otherwise you burn out, you're too tired. And then your breast milk also need calories, right? Need nutrients. So you also, of course, sometimes you know, people say it's very important. It naturally will help you to lose weight.
Yeah.
But mother also worry, I take this extra thing, will I put on weight?
So is this when we will actually look at recommending essence of chicken? Because you mentioned before that it's low in fat and it's high in protein. And of course, brand's essence of chicken is clinically proven also to reduce fatigue. So that really helps a mom if she's, you know, keeping up a lot of you know, wakeful nights, always up in the middle of the night from baby. For daddy as well, because daddy I'm sure will be woken up, or at least most daddies. I know some daddies they can sleep very nicely, but yeah, some daddies also get woken up.
That is later. Daddy, your first 2 weeks actually, that's why government give you, you know, paternity leave, because you're very involved. Your involvement is so important. But after you return to work, of course, you know, from Monday to Friday, you're zoned out already. But then your body also adjusted. You do get tired, but you get adjusted. You know, sometimes I have father, you know, say to mom, oh baby, you only woke up once last night, and the wife will laugh. Actually, it's more than that, because
he don't know, he doesn't know, right?
He slept through because his body is slowly adjusting.
Right.
So it's good because the weekend you're there to help her. Weekdays, mother, woman of substance. You know, try to do it right. I assure you, girl, when you set things right in pace and in good routine, you never look back.
Okay, so let's recap again, in case for new mummies who are just joining us on the live video. What are the 5 tips again that we need to establish good proper techniques? So we need to empty the breast frequently and on demand, especially during the day.
Night
And
on
night
demand,
also.
daytime I'll do it regularly. So because the amount you produce first 2 days is very little, so we can feed as often, even 10 times a day. So it's good that you actually let the baby latch, and then make sure the latch is correct, is deep, and you can hear the baby swallow. So naturally, early part, the baby suckle, you know, Jen, they suck, then they breathe, then after that, suck, then you collect enough, then they swallow. But when your milk comes in, usually on second evening to third day, when your milk is in, baby will suck, different pattern. Right, 1 or 2 suck, swallow, 1 or 2 suck, swallow. Then you can hear the swallow, and you can see the ear movement as well, the inside ear, because the olfactory muscle remove the milk, at the same time move the tongue, also move your earlobes. So it's a good sign. And then beside, you see the throat move.
Yeah. So this is where you look out for the indicators of whether the baby is really drawing milk from the breast and swallowing.
Correct.
And then you also gave us a tip, which I always hear in all your classes. Don't disturb the baby when the baby is drinking. I remember your tip.
Yeah,
Don't
very
touch the
true, Jen, very true. Years of helping 500,000 women in the world, from UK back to here, whenever mother breastfeeding, I don't know why, you like to touch the baby like this, touch the ear, and then touch the hand, touch the feet, then you beat the backside. All these are wrong body language. So I always like to say in my public world conference as well. Imagine you put a plate of food in front of your husband. Before you start eating, you go and stroke him over and see whether he can focus. He cannot focus, no way, isn't it?
Yes.
Yeah, you're disturbing the child. So it's important to stay focused. Let the child learn, basic first before you do that. And the worst thing is do this. And mother said to me, Jen, you say every time baby come to my breast, one suck, fall asleep. Because the day one you're telling him, go to sleep on my breast. That's what you've been trying to say to the child, which is a wrong indicator.
Right.
Yeah.
Right. So the signal that you send, the communicative signal that you send to the baby also matters a lot.
Oh yeah.
Okay. So communication is one with the baby. the position as well as the emptying of the breast, and then the last two, which I think is the last one, which is very important, is the well-being, physical and mental well-being of the mother.
Yeah,
right?
father too.
And father too, because it all get influenced and affected. Yeah.
Because your moods will be affected. If your moods is not well and you are very tired, then you're irritable, I don't think you can respond to that cue a bit better. So father is the same. If you are very tired, you can, your voice, your tone can change. So that's why family affair, everyone help each other. Try to divide the job out, everybody, but mom out there, please focus on your breast. Daddy is to help her. Even massage, it's very important. So to prevent lumpiness, that's why the father help mother to massage. When you do it right, later on I'll show you the skill, then the milk flow will be good. You don't need to massage half an hour. That's ridiculous. A few seconds, sometimes you enhance. Jen, example, you buy a lemon, you put in the fridge, then you take out, if you don't rub it, and you cut, there's not much juice, right?
Yeah. Yeah.
Right, it's an analogy. When you rub it a little bit, then the juice will come out better.
Yes.
Same,
Yes.
A quick massage helps a lot.
Okay, so that's good physical well-being for the mother as well, so that she doesn't have any engorgement
or blockage.
And blockage. And then also, Dr. Wong mentioned earlier that they need breastfeeding mothers need 500 extra calories. So make sure to eat well and most importantly drink well, because if you're on poor diet, then that will also affect the milk supply.
Yep.
Correct.
So if you're going to drink water whole day long, it become electrolyte become imbalanced, because you well know that if you drink, because you're so thirsty, right?
Yeah.
You drink water alone, then you pee. As you pee a lot, then your sodium is flushed off.
Right.
So your potassium and sodium electrolyte in your system may not be balanced. So that's why, as you mentioned earlier, we need to have some soup, and then nutritious soup, which is very beneficial to mom. Especially after delivery, first 2 weeks, they may not have the appetite.
Sure.
Yeah?
Yeah. And also, it would be good to take Brand's Essence of Chicken, because it also improves the quality and the quantity of your breast milk as well, and it's also very nourishing for the body. I mean during our examinations when we are younger, we always take this to improve our concentration. We are very tired, we are fatigued, so it also helps in that aspect as well.
Yeah, true. I remember my mom, my sister actually forced me to drink every day, brew the all this essence, chicken essence, to make sure, then you pass your exam, then you got good marks coming home. She's so happy.
Yes. Okay, so now let's have Dr. Wong answer some very commonly asked questions that we have received on breastfeeding as well. Let's flash the first question. So, is my baby drinking enough?
Well, this is the most common question. Your baby drinking is here, first 10 days, the baby do lose weight by about 7%. That's normal. But the mother always take it as, because my baby is losing weight, so I'm not having enough. It's not true. I go by the P frequency, hydration. So the first day, or at least 1 P, indicating well hydrated. 2 days, 2 P, 3 days, 3 P, 4 days, 4 P, subsequently more, 6 or P or more. And the color is clear, it's not concentrated. I also look at the pool color. The pool color is very important. It will change from black and gluey, become yellowish and watery. And the circle of the skin, and the alertness of the baby, and the settlement of the baby, how they settle. And then the also at the same time the lips. Make sure it's not too dry. So there is various factors we observe. Let us do the observation. All you have to do is focus on your breastfeeding, then we organize, put it in the chart, so you can show us, then we can discuss about it. Then we further adjust the plan.
Do you have instances where nursing moms, that means they completely latch 100% and they don't pump out, and then they keep telling you that, I don't have milk. Do you ever come across, they have doubt because they cannot see the baby drinking the milk like you would from a bottle? So actually do they have low confidence, and then they end up taking a lot of products that they think that they don't have enough milk, so they need to increase? Do you ever come across that?
I do. Actually, supplementary in the first few days is ordered by your pediatrician. So let your doctor do the job. If the baby really medically indicated needs the formula or whatever supplements, and that's fine. But for yourself, I think you shouldn't be, jumping to conclusion that baby is not having enough. So again, boil down to the method of observation, concentration, hear the baby, and then watch, and then have a chart, input and output. So like how long you feed the baby, and what is the color, whether baby pee, and what is the color of the poo, and so on. All this will help us to help you.
Right.
Rather than worry,
For those mothers who really do want to increase their supply, what kind of foods or what kind of galactagogues would you recommend them to take?
Well, first line management, first day always latch. Second line of management, if your milk supply is not there, we may have to, if baby too a bit sleepy, we may have to stimulate with pumps as well.
Okay.
Then we teach you to use it, the stimulation mode. And after that, also observe your, what we call your prolactin level. I know there are some galactagogue help to increase the prolactin. Prolactin is necessary release from the pituitary gland. It's very important, responsible for the production of the milk. Oxytocin, on the other hand, from the posterior side of your pituitary gland, actually help to release the milk. So again, understand the anatomy and physiology of the whole process of milk production. And then why people give you these like herbal things, or doctor prescribe last motilium, or what we call the domperidone.
Yes.
And then those are drug medication or herbs like help to release what we call more prolactin. So increase the prolactin, then increase more milk production.
And what are some of the ingredients like the,
we try not to take.
that mothers can take to increase
Well,
the milk
if you're
supply?
not diabetic patient, type 2 diabetic, or you've got previous history of thyroid, certain studies have done is on fenugreek.
Fenugreek.
But you got to have a very high level of it, dosage. So it's 610 milligram, 3 capsules 3 times a day, not in powder form, not in brewing form. It's high dosage. You're only able to work, otherwise it's useless.
Right.
And motilium is a medication that, if especially prescribed by doctor, if they think there is a concern, so it's commonly 10 milligram, 2 tablets, then 3 times a day, can be quite a bit of high dosage.
Wow.
All right, to kick off. After that, we wind you down. So wind you down slowly, and then you see how you go. But because fenugreek is Chinese say is very sharp, so you must take it after food. Right. The other things like essence of chicken is also. I'm just telling you based on the research, is actually better than lactation cookies. The benefit is much better because it's liquid form, and the cookies I know you got various goodness, but it's a comfort food.
Right. Whereas like Brand's essence of chicken is more of something to nourish your body, to increase and improve the quality of the breast milk as well. And
every country is different. They use all sorts of herbs like tinsel, and then all sorts of moringa and things like that. But be careful.
Moringa is what? The moringa.
Moringa is another thing. Moringa is actually from Philippines. It's a plant, the herb they brew. But some countries use various different things. When I was at the World Conference, very poor side of the India, they even use a whole peppercorn brewed in goat's milk or cow's milk. Mother drank it, next day she got enough milk to feed the whole village.
Oh, wow.
So every country is different.
Okay.
As I say, those are no evidence we're talking about,
Just traditional.
Yeah, correct. So we must make sure that you don't just take things for the sake of taking, because culture, harvesting, the weather, the rain, chemical contamination. So a bit mindful. Don't take things unless it's highly recommended. But I would not just take things for the sake of taking.
Sure.
Yeah.
Okay, so sorry, just a cut in a little bit. For mummies and daddies who are watching us live now, we are talking about breastfeeding with confidence. This segment is proudly brought to you by Brand's Essence of Chicken. And also, we have 5 lucky winners to choose today. That each will get to walk away with 12 bottles of Brand's Essence of Chicken. All you have to do is like and share this live video, as well as leave us a comment as to your favorite benefit of Brand's Essence of Chicken. And we will also be choosing winners from our pool of mummies who have asked us questions before this segment as well. Alright, so leave us your comments and don't forget to like and share. Okay, so let's continue on with our questions. A mummy is asking, should I wake my baby up for night feed? Which I think we covered very quickly earlier on.
Oh, well, nighttime, the baby actually sleep, in order to help baby to sleep through the night by 4 months when the circadian sets in, because I'm a working mom. In UK, I did a survey with all my nurses and my doctors and myself, and we felt that it's more actually healthier this way, and our production never set back when we return to work, because daytime we always try to encourage baby to wake up and do. Nighttime I leave it on demand. Baby cry, minimal interaction, feed the baby, change the baby if needed to, then I dim the light, I say to the child, put it back to cot, I say night. Avoid trying to nurse your baby until full sleep, because it's expectation. When he wakes up, I always like to say, example, Jen, you go to St. Regis tonight, and you go to hotel bed midnight, 2 o'clock you woke up, you found yourself at the swimming pool. You'll be scared, right?
Yes.
Same, if baby falls asleep at your breast, and then when you put him in the cot, creepily when he was asleep, when he wake up, he said to himself, where am I? Yeah. Then he wanted to be nursed again, expected to be nursed, back to sleep. Sometimes can be 1 hour or more. It's not quite right. So also a prolonged process like this, when the child grow older, you always expect to be nursed to sleep. Then that means no breast, no sleep. Then it's not very healthy. So I would suggest that we have sleep is a different topic on its own, Jen. So we actually have a good start. I think do things right. Have a good routine.
Right.
Yep.
Right.
Okay.
And for the middle of the night or even in the day, how can husbands be helpful?
Oh, husband very helpful. Especially the first 2 weeks, get your hands in. Trying to help mother learn to change diaper in the class. That also improve bonding, which is by research. Right, bathe baby, carry baby, burp baby. Right, when at night baby wakes up, you happen to be weekend, you return to work already, like Friday, Saturday is your turn. Like wake up, change baby, pass it on to mama, and then she breastfeed, then make her a hot drink, and then after that, while she's sipping a hot drink, then you can burp baby, then after that pass baby to her, after that you can settle the baby to sleep. And also daytime you can do organization, maybe ask your caregiver or your any helpers in the house, like go shopping, the list of shopping you need to do, and then also teach them various things, be organized. Then answer some, call for her friends, like, chat or whatever, while she's busy now. This is called organization. Send pictures to your in-laws, because now they cannot visit often if they're overseas. And all these are tasks they can do. So just being there, it means a lot. As I mentioned earlier, men's hands are more stronger. Just before she sleep, do a quick massage for her, and to prevent breast lumps and also help the milk flow.
Are you going to show us how to do the breast massage? So daddies, this is where you can help
right, breast
wives.
massage is very important. I actually I'm very particular about image. Your breast doesn't mean you're breastfeeding girls. You should have a saggy papaya breast. Your breast is an organ that's very no muscle, except a little bit muscle at the areola. The way you wear your bra, and also it's very important the way you massage. Gentlemen, just like by research, you put your hand on the dough and you do like that. And after you let go, the dough is set nice and round. If you start rubbing like this and like that, your dough become lengthened, like I call it la mian, become, like spaghetti. So again, I years of studies. I have mom massage her breast. I always say, I tell her, if you don't believe me, do one breast this way and this way. And there's 1,001 method, not right and wrong. But what is the best is important. Doesn't mean you come back to me and say, oh, because I'm breastfeeding, so my breast should be saggy. No. So what you have to do, Father, you can help her. This is called 6 o'clock. Rub upward. That is called 12 o'clock. And that is called 3 o'clock. And that is called 9 o'clock. And that is called scissors. And then what, you hold the breast and you do vibration. It just take a minute or two. And then after that, you can see when you let go of the milk naturally oozing. Because you really soften it down, and then the lumpiness will be gone. When you got lump, don't arrow in. You're going to make it worse. Remember just now, gentlemen and ladies, you're listening. No, breast is grapes. When you press too hard, it becomes raisin. Raisin got milk.
Okay, so daddies, I hope you've learned that good tip because apparently that is your job to help mommy to massage and to prevent any sort of engorgement.
Actually, take it as a family event. This is a factory making milk for your baby, your precious baby. So it's different things altogether. We're talking. It's working hard to get milk.
Right. Yeah. Right. Okay, so it sounds that daddies, you also have a job to do.
Oh yeah, plenty of job.
So for both mummies and daddies to stay refreshed and energized, you can also take the Brand's Essence of Chicken every morning together. So for mummy, it helps to improve the quality and the quantity of your breast milk. It even helps to increase the colostrum as well. And for daddies, because Brand's Essence of Chicken is also clinically proven to increase your concentration and to reduce your fatigue. So that is the benefit for you as well, daddy. So it's always recommended to take, drink together, cheers and toast to each other, one jar every morning. And then I think for mums in confinement, they can drink it, warmed up from the jar, or you can even pour it into your confinement the cooking and the soup as well. So that's also an easy way to have your daily dose of Brand's Essence of Chicken.
Mom out there, when you actually have a baby, you do get very forgetful, you know that.
Oh yes. I can personally attest to that.
Yeah, because you are so focused on your baby and so focused on your feeding, and they always say, hey, where's my phone? Oh, I forgot to appointment and things like that. So Father, appointment, remind her. You got appointment, and then beside the handphone, you could act as a reminder.
Right.
Yeah, get her mentally prepared, not last minute, then she got a rash, and then she get very panicky, and when you're in shock, like when you got blockage of the breast, like even engorgement, it can actually reduce milk supply as well.
Because you are stressed about it, you're in pain, right?
Yeah. So nothing can flow if you're very, very, screw up.
Yes.
That's a word.
Okay. Dr. Wong is always very real. I like that about her.
I just honest sharing rather than anything else.
Yeah.
Then cover up and make breastfeeding like roses or baby. Right? It's not true. It's challenging, it's tough, but you get there at the end.
So again, one of Dr. Wong's most precious tips is, mummies, please always establish the correct technique. Always have the correct mindset. And always send the correct signals to your baby, which is a small recap of what she mentioned earlier. Okay, let's go through our questions because we received so many questions from the floor before, and I think now during as well we have quite a few. Okay, let's do the ones that have written in first. So we have Ming Chiao on Facebook. Okay, so it's a 3-part question. Can I keep my pump parts, that means she keeps them in a covered container in the fridge after pumping, and only wash once a day? She is very tired to keep washing and sterilizing the pump parts every single time.
Yep. Initially, I think it's good to have, to sterilize them because you got a lot of helpers around. But once you establish the baby immunity builds up. So especially when you return to work, you no need to wash them. You can put in the Ziploc bag or in a container. Then you wash them when you return. So you need to sterilize only twice a day. But your hand must be kept clean. So the hand washing and touch the outside part, not the inside, and to prevent contamination.
Right.
Yes.
Okay, and she also found that Guinness Stout boosts her yield. How many hours before the pump? She's asking how many hours before the pump should she drink?
Irish people believe in that. It's made in Ireland. Guinness Stout.
Yeah, Guinness Stout.
Well, it's full of iron. Guinness Stout also has what we call spirit content. If I'm not wrong, it's about 7 to 9%. And a small amount when you brew them, you cook them in your stew, no problem. If you want to take it neat, and well, it's quite a small amount, like even wine, you take a glass of wine, you know, it will pick around 45 minutes. After that, it will actually metabolize. By the time 2 hours later, most of it would have gone. But if we're talking about quantity rather than just one, one
Just
drink.
timing, yeah.
Yep. So therefore, if you're going to take more, I suggest you brew them like Chinese. We say we brew them in together with the chicken. You double
I
boil
didn't know
them.
you can cook it with chicken.
Yeah, you double boil them. That is fine because the spirit content would have dispersed by then.
Right.
Yep.
Okay, so I hope that answers that question.
The maximum you want to take in it is 0.5 gram per body weight.
0.5 grams per body weight. Okay, that's something a bit more. Probably have to plug
more
a calculator.
medical.
Yeah, that's the medical
section.
Okay. Alright, so she's saying, is it normal that my skin changes after being a mother? My face is still okay. In fact, it's even more radiant and glowing as I consume more nutrient rich food. Because I'm taking it for my breast milk as well. But my hands and my legs turn more allergic. Oh, this sounds familiar. I remember sending you my picture of hives after I gave birth.
Well, sometimes I know sensitive skin is due to how you actually take care of oneself. Sometimes, traditional DCM, you bathe in certain herb, if you're sensitive to it, it can trigger off hives. Herbs usually bathe on the skin, on the body, you don't bathe on the face, you see?
Right.
Yeah, that's why you got hives around here.
Has it got to do with hormones also?
Hormonal a little bit. You are actually last time at the height of the good hormones. Then it's now maybe a bit dry. You didn't have time to moisturize yourself. And then sometimes pigmentation. And sensitive skin I see more often is due to people use sensitive to the oil they use for massage. Just a bit mindful. All right, that's all.
Okay. Yeah. Now we have another one on Facebook. Actually, not another one. We have so many. But okay, So Min is asking, should I feed the baby with formula milk if the breast milk does not come in?
Yes. If the doctor actually asks you to give formula milk, if your doctor say baby is needs some supplement, your pediatrician says so, then you actually can use it as a cup, or you can feed the baby as a syringe. Like I always shown people like that. Cup feeding, father, I quick show you. You support the baby, you can wrap the baby hands up so that they don't push you away. Don't put too much here. Doctor ordered 30, that doesn't mean you feel 30. Then if it's too much, when you feel like that, it will spill. So always put small amount, support the neck, baby not quite like that, let you feed, and talk to the baby, sit it there, and you can let the baby pace, lapse, or sit. Alright? That is called cup feeding. First few days, we try not to induce the bottle too early. If it's a syringe, scrub your hand clean, pump your milk inside your syringe, and you do this, and insert into the corner of the baby's mouth, baby suck on your finger, then the baby actually do suckle. This is a more effective way, less choking, less struggling, and the baby actually suck your finger, baby will not just swallow, and you learn a technique of suckling much better. Bottle is after a month.
After 1 month. Okay,
yeah, you must give a bottle. Right. If you don't, we got another problems.
Okay. Which maybe let's cover that at another time.
Later. Yeah.
I have another alcohol question. I think a lot of our mummies enjoy their alcohol. Okay, so Xue Fang from Instagram is asking, is it true that as long as you are sober, you can breastfeed your baby after drinking alcohol?
I was asked to do a talk in Tan Tock Seng with the NMPTs and the nurses there. Yes, when your brain is clear, actually the alcohol have dispersed already. Okay. You're asking me whether mom can breastfeed after surgery. I say as long as they're awake, they are fine. But as I say, again, mother, be careful there. I don't want you to accumulate too much. If you take too much, I have seen baby actually become euphoric 1 week later, and 1 month later become alcohol withdrawal symptoms. So the alcohol spirit is the harmful one. I also have seen mom herself, the milk supply is well known by research paper had dropped drastically because, alcohol spirit drying effect. Have you ever been drunk? I've been drunk before. Next day I look like 10 years older because you dry yourselves.
Yeah.
So moderation, girl. If you like your alcohol, take it after your breastfeeding and small amount, enjoy it with your husband, then have a dinner. After that, you don't need to pump and dump. Have a glass, it's good enough. It's very, very relaxing. Once a day, it's fine.
What if the mom is a very good drinker?
You're a good drinker.
She drink a lot already, but she still don't
You drink a lot, then it depends on the time frame.
Okay.
If you could drink more than too much, like 1 bottle of red wine, then as you yourself will be too drowsy to feed.
One bottle of red wine. Okay.
No. I think we have to be sensible. I myself enjoy wine, but a little bit you enjoy better. When you drink too much, after that you like drinking water. It's not nice anymore. You don't enjoy it anymore.
So everything in moderation, and also check.
Check timing. I will always suggest breastfeed first. You take any medication or any herbs or any alcohol.
Okay, from username, this Bella from Insta. Why are some prone to blocked ducts, etc., even though we did everything to prevent this from happening?
Blocked duct sometimes is due to your structure, like I mentioned just now. If sometimes mother actually bra. You wear a bra that actually congested it, or when you hold the baby to the breast, they're like spoke coming down of an umbrella. When you squeeze too hard, it causes occlusion. Sometimes when the little ducts, you actually blockage, you arrow in, you make it become hard lumps, become, like I mentioned, become raisin. Raisin cluster together, become blockage. Some other push so hard, all the tissue go to the front, it become a cork of the wine. So like in a cork in front, how can the milk flow? And the same with the wine. So therefore, sometimes there are various reasons. So most common, I see mother somehow more prone because sometimes they do not massage well. And number 2 is sometimes mother do not empty the breast properly. Right. We are human. Must remember that sentence. It doesn't mean you press no drop, 1 drop of milk come out. We're human. We're constantly producing milk all the time. So when you press, as long as just drip, there is a bit of milk, but you actually can feel it's lighter. Mother always say, when I squeeze very hard, there's still a few drops of milk. We're human. We cannot be like a type, you turn off, no milk come out. You know what I mean? Just bear that in mind. Be sensible. Not sure, I think it's good to WhatsApp us and then we can answer in detail.
Yes. I hope we can try to answer all the questions, but in case some mummies we don't get to answer them, don't worry, you can always contact Dr. Wong directly or leave us a PM and we can share, or you can go to Dr. Wong's website as well.
Yeah, us at wongboyboi.com. Our team actually can help you, or actually questions they are not sure, they'll siphon to me, then I can answer you anytime.
But we'll try to answer as many as we can now. Okay, so we have another question from Insta. How do we maintain our body and our milk while breastfeeding besides having quality meals?
Your body. Body is posture. Don't hunch. Otherwise, next time you make your shoulder very broad, like King Kong like that. And also, mother blockage. If you got very heavy breast, if you always like that, high risk of a blockage down below. And very important also is correct your posture. Antenatally, I taught them basic posture correction. So have good support of the baby when you breastfeed. Always lean back, not lean forward. Baby go to you, not you go to baby.
Right.
And for your body structure, carry yourself well, walk well. If you need a corset, wear a corset. It's fine. First few weeks, mother look very beautiful when they're breastfeeding. You know that because first time it's a natural. Your breast looks so good actually. Right, so it's beautiful thing to enjoy and feed the baby. It's nutritious. So I basically positive thinking, less stress, and then put a little bit. Make sure you wash your face, comb your hair at least every day. I had mother who are actually too worried. That is another topic on its own. They go into depression, and then postnatal blue, and then it's sad. We don't want that. Okay.
Okay. And of course, watch your diet as well as your, make sure to drink a lot of fluids.
Yeah.
I think it's very important. And of course, you can also have a jar of Brand's essence of chicken once every day in the morning, or twice if you like. Okay, so I have a mummy here, Ruzana Supa. She's actually expecting twins. So she's asking, when should I start expressing colostrum before giving birth?
Well, in Melbourne, there was research Australia. If it's mother is diabetic or gestational diabetic, we know that baby before birth they got a higher risk of hypoglycemia. Being twins, your colostrum mother worry may not be enough. But twins, the higher risk is a premature labor. So your doctor is a bit concerned. Then if you have colostrum, I think around after 36 weeks is okay. If you got colostrum during shower in the evening, you can harvest them in a very, very, wash your breast first during the shower, the breast is clean, and you can massage, and you can actually, harvest them in a syringe, put them in the sleeve. This is called the paper thing, it's called the sleeve. And then after that, you can ziplock them into in a bag, put in the freezer. You can, but always check with your doctor ONG first. But we do not want to trigger premature baby because premature baby the weight is divided. So we want them to be a bit careful. Right. So always check with your ONG and then whether you can do it. Then ONG give the green light. Then we are the one to help you.
Okay.
How to do it right without trigger of premature labor.
Okay. So Michelle is asking, so she's written through Insta. She said, for moms with inverted nipples, is it not possible for breastfeeding or even latching?
Well, inverted nipple, let us check you on the second trimester. Then we can correct you using a lot of gadgets. So if you are really missed by everybody, when baby is born, there is various ways. We can use nipple puller, we can use nipple shield, we can actually pump a little bit, get the nipple out. So no need to worry. So what I suggest that let us work with you. Ask at wongbohboi.com or ask your people around you, then use the gadget. But the only thing, be careful girl, Nipple gadget can pull your nipple during antenatal period, but it also can trigger premature labor. So your doctor will be concerned. Let us monitor you for half an hour before you buy the gadget. Then everything's well, then you can take it home and use it, and the nipple can be treated and pulled out. A lot of people like to buy things and then without being proper instructed. That risk is there. That's why your doctor is a bit more concerned.
Right. Okay. Thank you, Dr. Wong. Okay, so we have two mummies. Okay, now I think these are mothers who are already breastfeeding. So we would like to address their questions. From Yiman on Facebook. Baby makes squealing sound when latching. Does this mean that the latch is not correct?
Well, latching should have swallow sound, no clicky sound, no like chopping, chomping sound, because those are not quite right. Sometimes let us check oral. The tongue itself might be short or might be too thick or too round or too heavy or tongue tight. Let us check. So if you hear all those a lot of funny sound, let us check. Sometimes could be just some baby a bit messy Yeah. When too much milk come in, they got the what I mean. Some baby just a bit like a bit mischievous, but cheeky, correct.
Cheeky baby.
So let us assess, don't jump to conclusion, and don't go to website, because website people don't haven't look at you, how sit through with you, what is your latch like? Is it proper? Is it adequate? Is it efficient?
Alright. Okay. Another mummy Jesslyn from Facebook, to add on, how about if baby makes heavy breathing sounds while latching?
Well, babies just come out from the water world into the air world. They need to adjust to the air world. Some baby do breathe a bit heavy. So let us again assess for you rather than you sit there and get worried. And sometimes I say to mom, if you can WhatsApp her for half a minute of video, then we can tell you to go and see doctor. Is a concern or not a concern?
Right.
So again, we are out here to help you.
Okay.
Yeah.
Okay, and we have quite a few repetitive questions, which is a key question that I think we have not asked, but a lot of mothers will usually ask this. How do I increase my milk supply?
Well, increasing milk supply is have a good start. Kickstart a good supply. That means you have to have the 5 tips that initially we talked about.
Yes.
Very important too is rest and prevent yourself get too tired, and adequate intake of everything, food and fluids. And it also is a correct technique, right? And herbs and things like that, let us tell you whether it's necessary or not. Or medication like Motilin, whatever. So let us help you.
Okay.
Yeah. Most mother would have enough if you have a good start.
Okay, we also have a mom that is, I think, going back to work after maternity leave, which is very real. So she's, this is Joanne Chen, she's asking, how should we transit from latching to bottle when mommy goes back to work after maternity leave?
Well, after a month, I'll suggest pump your milk. Give it to the family member, or your husband is the first person enjoy to give a baby a bottle. So it's called imaging association. So very quickly, the baby see papa's face, then the bottle come out. See your face, the 2 boobs come out. Baby is established well on your breastfeeding. Baby unlikely to be confused. And this is good because it makes the transition returning to work much easier. I have also another problem in my clinic. Mother so good in breastfeeding, never offer a bottle. When she returns to work, baby doesn't want to take a bottle. Then it's another setback again.
Right.
Yeah? Okay?
Okay, Mommy Josephine Chua is asking, my baby only latches on one side. Is that okay?
No. Ideally, nature makes us have 2 breasts. In case one engine is down, the other one is still going. So I would suggest start right. Baby do have preference, because of awkwardness. Some baby just like the left side all the time. And when you turn him on the right side, he refuses. And the mother always offer the left side, eventually less milk supply here, and that baby will detest it because less milk, why should I eat? Waste of time, right?
Yeah.
So eventually you got one big giant breast here and little, small little breast there. When you go to dinner, where you wear, topless, like those
topless,
those sexy gown, shoulder off shoulder, I would say.
Yeah.
Then you look terrible. Right, one big here, one small here. You look awkward. You cannot wear something nice, fitting to show off.
Yeah.
I would suggest it's purely for baby's satisfaction. It's good to offer 2.
So offer the slow flowing one first.
I would always see if baby detests that side. I'll always offer that side first.
Okay, so always offer the detested side first.
Yeah.
Okay. Okay, I hope Josephine that actually helps you in your question. Okay, we also have another mummy, Ten Lee, also asking, hi, do I need to burp my baby after breastfeeding?
Oh yeah, burping is very important because early part babies, the food pipe is not fully developed. So if you burp wrongly like that, like your helper like to do and your nanny, you be prepared for merlion.
Oh.
So don't burp like this, don't burp down useless, don't rub his hair back because baby all got fine hair called lanugo. It lasts about 1 month. If you rub like this, it brings on static shock. And then next time the baby expect another shock when you actually support him his back because the negative reaction. So last 100%. not allowed to rock baby like this. Would you like me to rock you like this after a full meal char kway teow? You throw out. So please be sensible. Whatever I teach you is sensibility. You need to burp, support the chin, and then lean baby 10 degrees forward, and you just tap. Don't belch here. It's a kid meal, okay? Cup your hand and do it. No, you burp less than a minute. Baby will burp. Or sometimes sit baby upright, easily burp. Or if you're still not sure, we got various method, which I call the 5S, which easily help to burp the baby.
Okay. Okay. Let's see. Yi is asking, Yi from Facebook, any superfoods or ways to boost supply and feel good for mom?
Well,
Superfoods.
so there's no such superfood, but Asian, Singaporean girl, you're very pampered. You got the best of the East and all types of food. As long as balanced diet, and there is a lot of fresh vegetable and also fresh fruits, and you got lots of fish. Whatever is in the meat in the market. Eat it. Fresh, good quality food, and then again make sure you got balanced diet. Adequate nutrition of micronutrients, and also what we call liquid fluids.
Okay. This is a question from a mummy called Gemma Tan from Facebook. How long should I wait to supplement with formula milk if I kept trying to breastfeed but the breast milk just doesn't come?
Well, if your breast milk doesn't come, there can be many reasons. Even the very, very rare reason is the retained products of placenta. I also don't like mother to encapsulate the placenta and take, because they got a bit of hormones called placenta hormone. It can suppress your lactation. So initial part, the first 3 months is endocrine hormonal. Don't take anything that affect your, the prolactin hormones itself. So a bit careful. So let us ask us, on WhatsApp, then we can explain to you more, personally, adequately.
Okay. There's Joshua Pang on Facebook. Maybe this is a daddy asking on behalf of his wife. How can I fix nipple confusion? My preterm newborn was fed using bottle back at the hospital and now has difficulty latching when home.
Well, premature baby in the hospital depend on the severity of the conditions, and most pediatricians will use a bottle. But to be honest, as soon as the condition is stabilized, if I were you, Joshua, I would have told my pediatrician that we wish to breastfeed. So then we will have started in a different manner. Premature baby, we will start off very short feed. But latching is very important. We do skin to skin, and then when baby able to discharge, then we are the one to make sure that baby actually latch properly. I have done many times with premature baby, we never have problem. But if it succumb to one thing, one form of feeding, then it is challenging. It is.
Okay, I think we are coming towards the end of our session. Thank you so much, Dr. Wong, for sharing all the wonderful tips. And of course, mummies and daddies, I hope you've learned very important basics and things that you need to take note of, when breastfeeding or when starting on your breastfeeding journey. So earlier on, I've also mentioned, Dr. Wong, maybe you can help me to announce some winners as well. We have chosen 5 lucky winners who will each get to walk away with 12 bottles of Brand's Essence of Chicken, the only clinically proven essence of chicken brand to actually increase and improve the quality of your breast milk, as well as to improve your concentration and to also give you more energy and help you if you are fatigued. So we have chosen 5 lucky winners from our pool. Okay, maybe I will announce the first 2 winners, and then you can announce the last 3 winners.
Oh yeah, okay.
Okay, so when we announce, we also announce in the comment section, I believe. So do PM us for details on how to redeem your prize. So the first winner goes to Joanne Chen. Congratulations, Mami. Yay!
Well done.
And the second winner, So Min.
Yeah, well done.
Congratulations.
Okay, third, Gemma Julie Tan.
Congratulations,
well done.
Gemma.
Yeah, and fourth, Sarah Ng Pek San.
Congratulations, Sarah.
And last, Serena Wong.
Congratulations.
So congratulations to all of you.
Congratulations to our 5 mummies. So just watch out in the comment section for your names, and you can actually PM us for details on how to redeem the prize. So once again, we would like to thank Dr. Wong for her time with us. Thank you, Dr. Wong. And special thanks to our sponsor as well, Brand's Essence of Chicken. So, okay, for those of you who did not stand a chance to win, we still have 3 more winners that we would like to benefit. So all you have to do is, if you've been drinking Brand's Essence of Chicken for a while now, and you guys probably know more about the product because you are taking it every day and in and out, and good things must always share. Of course, Dr. Wong, you know that. So simply share with us on your IG story on how Brand's Essence of Chicken has actually helped you thus far in your parenting or your breastfeeding journey. Remember to tag Brands, and you 3 mummies will actually who inspire us will actually stand a chance to walk away with 12 bottles of Brand's Essence of Chicken each. Yes. So for those who want to find out more about this and more about Brands, scan the QR code which is on screen right now to visit Brand's Essence of Chicken's IG page. Alright, so I think we've come to the end of our session. Thank you everybody who who asked questions. I'm so sorry we didn't get to answer some of them, but you can always write in to Dr. Wong, ask
at wongboyboi.com, and we'll actually try to answer all the and solve all the issues.
Yes, Dr. Wong is always here to help. And I like how you are always, caring for the mother and always concentrating on the mother's well-being first and foremost.
Yes, my job is to empower you to walk through this journey with your husband and the family together. So it's very important, enjoy your whole pregnancy, learn what is right, and then, if you're not sure, you got time, and then please join antenatal class, you learn more. Then when babies arrive, then you can apply what you learn. Then it's very beneficial. I think years of teaching, they actually benefits more from attending classes.
Right.
Yep.
Okay, so hope you mummies have walked away with some good tips. We'll see you for our next live session soon. Stay tuned. Take care and have a good night. Bye-bye.
Bye-bye. Good night.
Good night.